Hi, I'm Dr. Alvarez with Endobariatric.com, and on this episode I would like to explain a little bit about the instruments that we use on a daily basis. We get it a lot through our Instagram stories and the clips that you see there while we're doing surgeries, and we get the questions, you know, what does that instrument do? How does it work? And today I'm here to explain a little bit about the most common instruments that we currently use on a daily basis. So as you may know, we do this surgery through laparoscopy. Laparoscopy is a technique of minimally invasive surgery. It's a very common technique, and this technique is designed to help patients recover fairly quickly. So our sleeve patients go back to work for a regular desk job between day 3 to day 5 or so, more or less, maximum day 7. So what does this technique do? Well, this technique involves these Trocars, which is these instruments that we see here. You see it's pointed right here. And what this does, we're able to go through the abdominal wall, remove the Trocar, which is this pointed instrument that we see here, and we're left with the sleeve. Through the sleeve, which looks like a little straw, we're able to insert different types of long instruments, just like this one. This one is a grasper, and as the name mentions, this is designed to grasp tissue. All right, so the length may vary from certain distributors. We use laparoscopic, bariatric lengths which are longer. Why? Regular laparoscopic surgeries are normally instruments that are 33 centimeters, which is more or less that length. We use 46 because this is a bariatric grasper, and the reason is, as you may know or imagine, dealing with patients who are obese, some patients may have like big abdominal or very thick abdominal walls because of the fat tissue. And that is why we require longer instruments that are bariatric, like this grasper right here. So you see here the sleeve of the trocar, and we're able to insert the desired instrument and move it, twist it, and be able to grasp tissues inside. Okay, so these are the trocars, the sleeves, which come in different diameters, which is like this one right here is 5. We have this is a 12 right here, and this is also a 12 right here. And so this is a grasper. This is something we use on a daily basis. On my other right hand, I normally use this instrument right here. This is a ligature. This is an instrument made by Covidien in the United States, which was bought by Medtronic. And this instrument, as you can see here, goes connected to a console. That console will help us. It does help us identify when tissues are sealed. And I'm going to, so you can zoom here. You see 2 blades, and what this instrument does is this instrument produces heat between the 2 blades right here to be able to seal vessels. Once the tissue is sealed, the console will let us know, and it will emit a certain sound letting us know that the tissue here has been sealed correctly. It won't bleed if we cut it, and we are able to cut this after we're pressing this button right here. And once we hear that sound that the tissue has been sealed, we're able to use this trigger right here, and the blade will go through the tissue and divide the tissue. A sealed tissue, bloodless. The idea is to be able to loosen the whole greater curvature of the stomach, loosen from point A to point B, all the way to the angle of His, without any bleeding. And that is what that instrument does, and that is why we use that instrument on a daily basis crafting sleeves. Once we have the stomach freed and completely freed from point A, from the antrum to all the way to the point B, which is the angle of His, we're able to staple the stomach once we insert a calibration tube. The way we staple is using this instrument right here. This is an EndoGIA. This is the GIA stands for its initials, which is gastrointestinal anastomosis. And the history on these laparoscopic staplers come from traditional open staplers, which were named GIA, gastrointestinal anastomosis. Now these are endo because they're laparoscopic. At the end, I have attached a brand new cartridge here, and which is this part right here. These are disposable. The stapler is disposable. We normally use between 5 to 7 of these during a sleeve surgery. And let me just put it back into place. And this right here is the cartridge. The cartridge from the stapler I'm able to open, close until I'm sure where I want to fire this. And if you know, I'm also able to slant the stapler to one side or to the other. And once I'm ready to fire this, you'll notice that there are 3 lines of dotted lines on one side, 3 lines of dotted lines on the other, and there is a thicker line in the center. The thicker line is the blade. So what this does is this throws 3 lines of staples on one side, 3 lines of staples on the other, and on the center, on the midline, it throws a blade. The blade divides the tissue after it has been stapled. So that way we're able to staple the stomach on one side and on the other, cut in the center without spilling any gastric content in the surgical site. So this seals and seals with staples, 3 lines of staples, 3 lines of staples, and divides in the middle. This is one of the brands I normally use and like to use, which is Medtronic. I also like to use Johnson & Johnson, and top premium brands around the world. So that's what does the stapling. Does the magic. Of course, crafting the sleeve, it's how you use the instruments. That's where the art of crafting sleeves comes in. After we're done cutting and stapling all the way up, we're left with a sleeve. And my preference is to use this instrument right here, and I get this a lot because I'm probably one of the few surgeons that likes to use this instrument, which is called EndoStitch. This instrument right here has a suture at the end. In this case, this is a short silk suture, and the reason I like this instrument, it's because it really goes really quick on sleeve surgeries. I mean, if you use a regular needle driver versus this is going to be way quicker. I don't want to know how fast you are stitching or using your needle driver. This thing flies. I normally it takes me about 4 to 6 minutes to overstitch the staple line with this instrument. And the way it works is you may see that the suture is attached to the tip right there. I'm able to open this, and you can see a needle, but it really is a needle, special needle that is in the shape of a T. So I'm able to decide if I want to send this needle to one side or the other. So that way I can have the tissue in the center and pass this to the other side back and forth without wasting any time, which is very valuable in the OR. Specifically talking about patients who are obese, that you want a really quick surgery, less time in the operating room, and that equals to safety. So this instrument may vary what suture you have here. It may be an absorbable suture, a non-absorbable suture, it could be a multi-filament suture. There's different types. So pretty much that's it. We've got the grasper, the ligature I use daily, the stapler, the cartridges that we talked about, the trocars and the sleeves, and the suture. So I hope this helps. If you have any other questions regarding any other instrument that you see on my Instagram, let me know. You know, I take care of the messages myself, and that's what we're here for. I hope you find this useful. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.